Welcome to Daily Series, COVID-19 Special. 13 healthy ways to celebrate the holiday during coronavirus pandemic. For safety's sake, wear a mask if you're inside with people you don't live with. As Christmas, Kwanzaa, and New Year's approach, many of us are looking forward to celebrating the season. But with cases of the novel coronavirus skyrocketing across the country, infectious disease experts are worried about the ramifications of holiday gatherings and travel. Our numbers of deaths and COVID-19 cases have never been so high, and our hospitals have never been so stressed. A lot of that is a direct consequence of people making poor decisions at Thanksgiving. It's very exciting that vaccines are now being deployed to prevent COVID-19, but the public health emergency is far from over. This is a wonderful moment of hope, but we are still in a crisis. I believe things will get worse in the coming months. We can't slack off. In fact, we need to do the exact opposite of that and do everything in our power to prevent the spread of COVID-19. Knowing the risks can help you decide the best way to celebrate the winter holiday season. While some of the choices can be painful, such as opting not to visit extended family, or deciding to attend religious services virtually rather than in person, many of the things you can do to stay safe are relatively straightforward. Wearing a mask, social distancing, washing hands, all those basic things actually work. Wearing a mask is inconvenient, absolutely, but it's not really hard. If you look at the things that people do for their health, chemotherapy, open heart surgery, those are hard. Wearing a mask is not hard. Taking precautions can also offer some peace of mind during the holidays. You can be free of guilt and know that your actions didn't contribute to the death of someone else. 1. What is the safest way to celebrate the holidays during the pandemic? The highest risk situation for coronavirus transmission is when people from different households eat, drink, and talk together indoors. The only thing with a higher risk appears to be when people go to drink alcohol at a bar. I would propose that in order to eliminate that risk, stay home and stay with your nuclear family. Get on social media, get online, and have a virtual table together. That works 100%. No one's going to catch COVID-19 that way. 2. If going to travel, what's the safest way to do it? The winter holidays are usually a busy time for traveling, whether to see family or spend a few days on the ski slope or a beach. But this year, experts predict that more people will stay home. The travel service AAA announced that it expects at least 34 million fewer travelers compared with last holiday season. Travel increases the risk of getting and spreading the virus that causes COVID-19. Experts strongly urge people to stay home. Determined to travel anyway. Know that when COVID-19 safety protocols are in place, the risk of becoming infected while inside an aircraft is relatively low, in part because the air exchange rates are extremely high in modern jet airliners. All commercial airplanes built after the late 1980s and a few updated older airplanes mix air from within the cabin with outside air. The recirculated air passes through a series of filters 20 to 30 times per hour. Unless you happen to be seated directly next to, in front of, or behind someone who is shedding the virus, your risk of being infected while traveling on an airplane is very low. You face a higher risk in parts of the airport where people tend to cram together, such as in the boarding, security, and baggage claim areas. Throughout your journey, it's critical to wear a face mask, social distance wherever possible, and wash your hands or use hand sanitizer. 3. If decided to spend the winter holidays with extended family or friends, what can you do to reduce COVID-19 risk? There are a number of strategies that can help make your celebration safer. A. Limit the size of your group. A holiday gathering that only includes members of your own household is safest, according to the CDC. Beyond that, smaller groups are better than larger groups. The bigger the group, the harder it is to reduce or limit contact between people. In general terms, the more crowded a gathering and the more time indoors, the greater the risk. B. Gather outside. Coronavirus transmission risk is lower outdoors compared with inside. In much of the country, you could have a dinner fairly safely outside and probably not be too cold. In fact, in states like California, Florida, and Texas, temperatures could still be warm enough for outdoor gatherings. C. Open a window. If you can't host the gathering outside, make sure any room or space you use is well ventilated by opening a window, advises the CDC. This can help dissipate any virus in the air. Opening windows that are opposite from each other to create cross-ventilation is even better. D. Social distance and wear a mask. The CDC recommends wearing a mask when you're inside with people you don't live with or when you're less than 6 feet apart from them. You need to be especially careful to maintain distance when you're eating and drinking, since you'll need to lower your face mask. This still wouldn't necessarily protect you because we know that small particle aerosols that are generated by talking can remain suspended in the air for 3 to 4 hours. E. Wash hands frequently. People should wash their hands thoroughly for at least 20 seconds, with soap and water when arriving at and leaving any social gathering. People should also wash their hands before serving or eating food. For drying hands, it's recommended that people use disposable hand towels or paper towels rather than sharing a towel. If there is no available place to wash hands, people should use hand sanitizer with at least 60% alcohol. 4. Who should most emphatically not attend a holiday gathering? People should not host or attend an in-person holiday celebration if any of the following statements apply. They have been diagnosed with COVID-19 and haven't met the criteria for when it is safe to be around others. Those guidelines can vary, according to the CDC, depending on the person's symptoms and overall health. They have any symptoms of COVID-19. They are waiting for results from a viral test for COVID-19. They may have been exposed to someone with COVID-19 in the prior 2 weeks. They are at an increased risk for severe COVID-19. Older people should be especially wary of celebrating with family or friends they don't live with. The older a person is, the greater their risk for being hospitalized for COVID-19. In general, the risk of death also increases with age. 8 in 10 COVID-19 related deaths reported in the United States have involved people age 65 and older. Relatively common medical conditions can also increase a person's risk for severe illness due to COVID-19. Type 2 diabetes, chronic obstructive pulmonary disease, heart conditions, and obesity can put someone at higher risk for complications due to the coronavirus. 5. Can I make a number of stops? I have a lot of friends and family to see. The practice of stopping in and visiting with different households is an especially risky idea, especially if those visits take place indoors. Fostering these connections with old family friends and relatives that we don't see very often is a great idea. Please do that, just not in person. Take advantage of this amazing thing we have called the internet. 6. How can I be sure that everyone I'll be with during the holidays takes the coronavirus seriously? If you're going to someone else's household or having people into your own household, that is a threat. People need to be honest about who they've been hanging out with and what precautions they've been taking. It might be difficult and even stressful, but you need to have explicit conversations in advance with everyone who will be at the gathering. Do they get the importance of masking and social distancing? Does everyone who plans to be in the same household understand the importance of prevention? Can they really follow those guidelines? If they can't, then I would suggest forming a different plan about how to spend the holiday. 7. If everyone agrees to wear a mask and social distance at a holiday gathering, does that make it safe? Wearing a mask and social distancing will dramatically reduce, but not eliminate, the threat of spreading COVID-19. Then the question becomes, if someone is visiting a relative who they are eager to see and who they haven't seen in a long time, are they really going to cover their face diligently and carefully within that household for the entire time they are together? I think that would be very hard to do. In those situations, people need to be realistic and honest with themselves about the precautions they are willing to take. The safest option is to celebrate only with members of one's own household. 8. Extended family will be wearing masks or social distancing. Taking certain precautions, such as staying away from people outside your household for 2 weeks before the holiday, can lower your odds of spreading the coronavirus. The simplest way to safely merge bubbles with other households is to insist that everyone who's planning to get together follow the rules of prevention very rigorously for a full 14 days before the gathering. In truth, everyone should be following those rules anyway. The recommends 14-day quarantine is the best way to reduce the risk of spreading COVID-19. The quarantine can end after 10 days if a person has not developed any symptoms, or end in a week if the asymptomatic person also tests negative for the virus. COVID-19 testing is an important way to lower the odds of infection. If everyone who is going to gather is able to get tested within 72 hours of getting together, that would dramatically reduce the risk. But it wouldn't 100% guarantee that no one has the infection. 9. Should I avoid going to religious services over the holidays? Getting together with people outside your household is how this virus gets spread, and that includes religious gatherings. Try to find ways to celebrate your faith in an individual way, with your own household or virtually. People should know that their decisions really do make a difference in the spread of COVID-19. People should not be gathering for any purpose. 10. The COVID-19 case counts are low or high at holiday destination. We would be more concerned about the individual behavior of the different people who you will be spending time with. If those people have been following the guidelines carefully in the weeks preceding the holiday and everyone practices social distancing and wears a mask while you're together, that's probably more important. 11. Steps to take after the holidays if you let my guard down. If you think you may have been exposed to COVID-19, or if you weren't always diligent about masking and personal space, then by staying away from people outside your household for the subsequent 14 days, you will have eliminated the chance that you might inadvertently spread the coronavirus to others. 12. Is shopping in person for post-holiday sales too risky? If you need to scratch that shopping itch, do it online. It would really encourage people to not go out and mix with hundreds of strangers in their quest for a good deal. If you choose to do so, you need to follow all the same rules on masking and social distancing, which may be harder to do in a busy store. 13. Can't we just have one small break from the constant COVID-19 worry? Although you may be growing weary of following COVID-19 prevention guidelines and want to spend time with loved ones, it's important to consider the potential consequences. We've worked with people who have unintentionally spread this virus to others who subsequently died of the infection. This is a heartbreaking problem. The individuals who spread it to others, even in spite of their own best intentions, have to live with that for a lifetime. By being extremely meticulous in following all aspects of the guidelines, you can eliminate at least that part of the tragedy of COVID-19. Better be safe than sorry. Don't forget to like and subscribe. Thanks for watching. See you tomorrow.